Hello, everybody. Sorry. My name is Eugene Kandel. I'm the CEO of Startup Nation Central. It's my pleasure to be here. Thanks to Bruno Cohen and Galleon Foundation for inviting me to this distinguished gathering. Startup Nation Central is a nonprofit that promotes the positive impact of Israeli tech innovation on the world. And digital health has been one of our main areas of focus for the last 5 years. It's really an exciting area, and in Israel it's expanded to over 600 companies. Many of them are getting significant traction around the world. Over 200 are COVID relevant. Most of them are software and data focused. One of them actually represented on today's panel. Digital health has got two major boosts by Corona. First of all, the tools are getting very useful to treat people when distancing is important and data is even more important. But second, perhaps more important for the post-Corona, is that we have broken psychological barriers for remote medicine in its various applications, from diagnostics to treatment, for physicians, patients, and system managers alike. Hundreds of users before were replaced by tens of thousands. And it works and it's efficient, and we all got used to it. And so the question is, how do we make this change sustainable in terms of technology, workflows, social norms, and business models? I definitely look forward to hearing the insights from this distinguished panel. I now turn it over to Gil. Bashe, Gil, please.
Professor Kandel, thank you so much. And I also want to just add one thing about your participation here today. I know you're very, very busy. You and the whole organization are putting together a conference next week, September 8th to the 10th, called The New Digital Age. I know that you have more than 700 people registered for this virtual conference already. I think people should look for this conference online. Obviously, I'm happy to send out information about it. And again, it's called The New Digital Age. It's next week on September 8th and 9th. That's so great. Thank you so much for everything you're doing on the behalf of health innovation. You know, all transformations are hard. And for some reason, digital ones are harder. In some cases, digital health has been close to impossible to impact on our global health system. And as you point out, COVID-19 has changed that. It's changed the mindset. It's opened purse strings. It's changed the attention of executive leadership and the holders of the decision. Years of research on transformation have shown that the success rate for efforts, transformational business efforts, is actually less than 30%. And as you point out, COVID-19 has actually put the foot on the gas pedal of change. Successful transformations improve performance. They enable companies to improve service, operations, output, profit. Most importantly in our area, ideally improve patient access to care. But when it comes to health, access and discovery, we've often seen our sector slow to change. Today, 5 outstanding leaders will guide us to the future. They'll map out exactly what all of us should be looking at. And Professor Kandel, Eugene, I invite you throughout our conversation today to listen closely to our 5 guests and map out and summarize for us, as you would for your students at Hebrew University, summarize exactly what you think are the 5 most important, vital takeaway points from today's conversation. I'd like to introduce our panelists. They're world-renowned. I'm not going to introduce them by their titles. You can see the website for that. They're known for their illustrious awards and honors. Obviously, they're writers, they're speakers, they're business leaders, they're champions of innovation. I'll provide a little insight about each one. Dr. Amir Kalali is one of 2 physicians with us today. Most people obviously study one type of medicine. Dr. Kalali is both a neurologist and a psychiatrist. He's concerned with policy, he's concerned with technology, he's concerned with drug discovery and development. He really is a guru, and a lot of us who know him know he knows a lot of the big decisions about our careers and lives, sometimes even before we know. Jane Metcalfe. Jane Metcalfe is really one of the champions of edginess and ideas. As a matter of fact, speaking of edginess and ideas, she's just come out with a new fantastic book called Neo.Life. And Neo.Life you can find it by way of her website. I am very, very fortunate to have been one of the first recipients, purchasers of the book, I might add. And I have a signed copy. And I'm sure if you reach out to Jane by way of her website, you can make those arrangements. Dr. Junaid Bajwa, he is a champion of medicine. He sits in London. He's an advisor to the National Institutes of Health, the National Health System of the UK. He's had a global impact on biopharmaceutical development. He now has taken on a very new position at Microsoft Research, where he's the Chief Science Officer. Shwen Gwee. Shwen Gwee is both a scientist, he's a scientist also of digital transformation. And it's so important to look at the fact that when we sit in the health industry, that we understand what's going on. As a matter of fact, many companies, McKinsey recommend that to really have a successful digital transformation, you've got to combine the people who actually know digital technology with the business leaders. And Shwen is really one of the pioneers in making that happen. And Uri Bettesh. A lot of our conversation sometimes talks about the theoretical. Uri is involved in the practical. He has created a company and a system and an infrastructure that is being used today by countries, by states in the United States, by hospital systems, and down to the county level. How do we use technology? How do we use the power of our smartphone in order to reach out and help people who need some care? So I'm going to jump right into this conversation today. And I'm going to ask a particular question. Really, I'm going to start with Shwen. And then I'm going to ask Junaid to pay very close attention to this question. You know, our industry has been very slow to move to change. COVID-19 is changing that somewhat. But I'd like to ask, beyond COVID-19, for both of you, since you're insiders of industry, was this change really happening before COVID-19 hit? Were you working on certain things within your organizations that really were just pushed forward because of COVID-19? And what do you think will be lasting? Shwen, please, what are your insights about that?
Yeah, thank you, Gil. I think the short answer to your question is that there were a lot of things that were being worked on over the last few years. And certainly, you know, I've been in this space of the crossover between digital and pharma for the last 15 years or so, and have been entirely focused on digital strategy and innovation. So there's been a lot of work that has taken place over that time. And certainly one of the things that has come out of that is the cultural change that has happened inside, where people are getting much more used to leveraging digital. And so there has been incremental growth over time. I think there's not a company or brand now without a website, for example, although in the early days, you know, it was a hard fight to get people to understand why they needed a website. Right, so people are getting used to what's the norm now. And certainly those trends a lot of them are being set by big tech platforms and consumer-facing organizations like Google and Uber and so on. So the expectations are different. And pharma is starting to realize that they actually need to meet those expectations to really meet the customers and the patients where they are. And so there's a lot more increase in digital adoption as a result of that. But I think certainly when COVID hit, that was really a point of acceleration where a lot more they didn't have a choice, right? There was a lot more incentive for why they needed to do it. There was no other option. And so it certainly accelerated the adoption of many things that people were just trying out and experimenting with, but now became a necessity because of what happened with the complete lockdown of in-person meetings.
Yeah, I mean, Junaid, what do you think about this? Can you push it further?
Yeah, maybe just to build on some of Shwen's points. So in my mind, the industry is within a macro context of healthcare. And if you look across the 10-year horizon, we know that the World Health Organization will tell us that the world will have 18 million less doctors, nurses, and pharmacists on the planet than what society needs. In a world where we'll have increasing numbers of aging population, the pharma industry lives within that context. So in a world where you'll have less healthcare professionals caring for patients, yet access and affordability are critical to the future of healthcare, it's not sufficient in my mind and many colleagues that I would speak to within the pharma industry just to be that company that creates breakthrough medicines. If you can't then think about how that medicine is then delivered to that individual and you don't think about the infrastructure that needs to exist for that medicine to have the biggest impact that you can have in society, then you're only doing part of your job. And at a time where science prevails, and at a time where digital transformation is happening faster than I think we've ever seen it before, what is the role that pharma can play in adopting some of these to change some of the model? Could that be across discovery, development, manufacturing, real-world evidence, or indeed commercialization? I think the biggest real-world evidence trial of our time is coming up in the next year and the year after, as we see the numbers of vaccines that are accelerated through the market. And how do we test the validity and the scientific value of those medicines? It will only really be leveraged through data, digital and analytics, things that the industry must now adopt.
Yeah, I'm just curious. I want to ask Amir to spin off your question, Junaid, because, you know, Amir comes from the large-scale clinical trial world that you're referring to. And for years, of course, you know, the industry had a set way of conducting trials. That seems to have changed. The question we have from our call today, our conversation is that change now related just to this period of time, the window we're facing? Or do we think that the COVID-19 environment or change transformation will actually be more enduring? I mean, Amir, what do you think about that?
So that's really the big question, whether all the changes, whether in the general medicine area of telehealth versus all the remote methodologies and clinical trials, everyone wants to know, is this going to stick, or is this something will go back to normal? And I don't think we have an answer to that yet. People, certainly advocates within industry and outside, are hoping that these changes will be permanent. I don't think we know yet. I think the jury's out for that at the moment.
Yeah, but if I could push you for a second, because I know that you're connected to people like Amy Abernathy at FDA, and you know, you and she are always in both public and private conversation. I won't ask you to reflect on the private conversations you have with the deputy commissioner, but deputy director. But from your standpoint, we both know that clinical trials right now are really on the decline in terms of patient enrollment. What role is patient recruitment going to play in making that happen?
Sure. So you're correct that certainly during the spring and early summer, we had a dramatic decrease in number of patients being enrolled in clinical trials. And I think academic centers were suddenly completely shut down. There are private investigator sites who were actually open essential services and continued to actually see patients. In fact, in some areas, there was, especially in mental health, there was actually more need by patients to come into clinical trials because they were actually finding their normal care just unavailable to them at the time. So I think it was kind of a two worlds, quite frankly, within that. But I think all the different parts of the ecosystem had to really understand how they were going to continue developing these other drugs. So, I mean, many people, let's say for Alzheimer's, I mean, we're very focused on COVID, rightly so right now, but there's a huge impact on other unmet need where people were developing hundreds of treatments and those were being really delayed. So although COVID, I would think most people would think of as an accelerant, especially when it comes to digital transformation, it has had definitely a delaying sort of impact on many other areas that are not COVID specific. So trends that might have taken decades, I think if people have mentioned, they've kind of happened overnight through what I see as a forced innovation, right? This is all the things that everyone said couldn't be done, can't do it, all the barriers, all the excuses. They kind of were caught naked, like the tide went out, and they're like, oh, I guess we can do it. So I think that's definitely happened. Yeah.
Uri had said to me before our, sort of jumping on live, he talked about the evolution of Datos-Health. And in a way, the complexity of our fragmented health system, and I'm wondering, in light of your comments, Amir, if Uri could comment, how our fragmented universe really creates almost built-in obstacles to this sort of innovation that you're referring to, that Junaid referred to, that Shwen referred to, from actually taking root. In other words, despite the good intent of the system, is the system itself the obstacle to life-changing innovation? I mean, Uri, is that on target? What's your reaction to that?
I think it definitely opened the door, and when you look today at when we work with big organizations, and you look both on the provider side and on the pharmaceutical side, And I'm going back to what actually Amir just pointed out. It's more of a question why can't we do that, as opposed to prior to the COVID-19. It's always the question is that's probably not going to work. Let's not do that. And today, when you look at clinical processes, many of them are looking at the digital transformation is how to take those clinical processes that were manual or face-to-face and to convert them into virtual. And during the COVID, if you look at, for example, at oncology patients, they cannot come to the hospital to be enrolled to clinical trials, and that's a big problem. So all the enrollment process around that, around oncology, is now going virtual. And it's not only the video conferencing, it's also around the consent and the digital communication between the subjects and the patients. So back to your original question, whether is that going to stay or not, my personal opinion, I think that we are we are in the right direction. We saw a peak during April and May last year, or I'm sorry, this year. But it's not going to go back to what it was before. We're still going to have a lot of, we won a lot of battles in the digital transformation in the last half a year that not going to allow us to go back to the old days.
You know, Uri, I was thinking of what you just said, and a conversation I had with Jane. Jane, you know, as we know, was one of the co-founders of Wired magazine, and we know the magazine from the newsstands, of course, but we forget that Jane was in the room with many of the early pioneers of technology, of digital technology, and she saw things succeed and fail. You know, Jane, would you put back on that sort of like the reporter's visor and give us a perspective of what everybody has just said? And I'm just curious from your point of view, you know, sort of ideas are great, but what will take hold post-COVID? I mean, that's the whole purpose of our exploration today. Can you give us any insight from your vantage point of 2 or 3 things that you're looking at to say, these are things in health that will have staying power?
I would not hesitate around whether or not some of the changes that we're seeing now will persist. I think it is so much more efficient. I think it's a matter of collecting the data, particularly the outcomes data, to actually make the case. But the benefits of virtual care so greatly outweigh so much of the current system that I think it is inevitable that not only what we're seeing now will persist, but I think it will accelerate the move towards you know, the virtualization of other aspects of our healthcare systems that have not yet gotten the investment or the attention, like things that are less the low-hanging fruit that might be a little more complicated. And
so,
you know,
Gil, can I comment on that?
Wait 1 second. Let me let Jane wrap that one up.
Sure.
So what I was going to say is that you know, the digital revolution happens in fits and spurts, and you know, looking back, you know, 30 years ago to what we considered at the time the dawn of the digital revolution, I think, you know, we're surprised by some things that took so much longer than we expected, and other things that just happened overnight. And, you know, there's enormous difference between, you know, the technology industry itself and the healthcare world as it's transformed by technology. So it's dangerous to draw too many parallels. On the other hand, you know, I think the outcomes, the efficiency, the lowered cost, the benefits, you know, physicians can, of course, see so many more patients. Of course, that could exacerbate the physician burnout aspect. But I think we've opened the door to something we will never go back on.
Well, Amir, you wanted to add to what Jane said.
So what Jane said made me smile, because I'm often accused of being too logical and making too much sense for our healthcare industry. So Jane said, you know, the evidence, you know, will show that. So what's interesting, though, is the question you're asking is, what's going to, you know, the resistance, right? So what Jane is saying makes perfect sense, that, you know, if you have the evidence, you would assume that people will pivot that way, right? the sad truth is that's not necessarily true in industries. Now, I think the key here is, I think what Jane was talking about, to the consumer, to the patient, it's obvious that they might have advantages. So the real question is, how much influence and power will the consumer have to drive those changes as the actual people are using that? But the thing about healthcare is, unlike a consumer market where the consumer is your customer, in healthcare, many times the consumer is not your customer as a business. So I think that's where the disconnect is. In any other consumer health kind of or consumer business, you really listen to the customer. That's not really true necessarily in pharma or healthcare. So that's where I think the jury's out, because it makes all the sense in the world that we should go to these new ways. Whether we will or not will really depend on the pressure that advocates will bring on the industry.
But that's that the only benefit is to the consumer. There are enormous benefits to clinicians. I spent yesterday with a friend who's an MD who is able to see, 13 or 14 patients during the course of a normal day, but she's got 3 other days during the week when she's only seeing virtual patients. Mm-hmm. It's a vast improvement to her workload and process.
But
clinician collaboration.
Let's hold that for a second, both of you. Okay. And let me flip over to Uri for a moment, because he's living the dream or the nightmare. We're going to find out for a second, because Uri's had to create a practical platform of population health that connects doctors and patients and health systems. I mean, Uri, you've been listening to this conversation. You're kind of in the practical mud of it all. What do you think?
I think what is interesting about the COVID is that prior to the COVID, you had the option to opt into virtual care, to a remote care program. And if you didn't want to, you always have to fall back to go to the traditional physical face-to-face care procedure. These days, people, also we as a company, we don't have a choice. We need to support all population. So people that don't have smartphone and seniors and a lot of other people with disabilities, and suddenly we don't have a choice. We need to support everybody. And also on the other side, on the consumer side, as Jane said, they also don't have a choice, and they need to use those virtual services. So I think it's open our eyes and allow us to really understand what's going to mean in a large scale to go virtual. But at the end of the day, I think that, as Jane said, it's we are all in the business of bringing remote into the day-to-day workflow, and the ability to transition between one situation, virtual care versus physical face-to-face appointments. That's going to be the future. Jane talked about 2 days virtual and 3 days face-to-face. I think it's going to be hybrid mode all the time, and that's going to be the future. But also related to our employees, there need to be a better time management for the MDs. When you go virtual, it's very easy to be swamped into back-to-back, and there is no time to take a breath and to take a 5 minutes break. And we need to better time management for the physicians.
No, I don't think, Uri, that we train our physicians in medical school. I mean, I'll ask Junaid this, but I have a particular question for him and Shwen. But I don't think we train our doctors to deal with this. I mean, Junaid, one of the things I've noticed with your work with NHS in the UK, which is a pretty amazing system, is that you've also been championing and introducing us to other systems like Babylon Health, the use of chatbot and artificial intelligence. And you've had this humongous global perspective about the future of digital as it pertains to care. And yet when I'm with you and you're talking about being a physician, I feel from you the intimacy of what it is to care for a patient. So on one hand, you're dealing with insurance policy and hospital systems, you're dealing with the future of technology, and then you're talking about someone down the road who you have to speak to as a health condition. And oh, by the way, you're chief science officer at Microsoft Research. Tell us what you've just heard. I mean, how is technology making your life better as a doctor?
And so maybe we could take that, Gil, from a COVID-19 perspective, and then think about what a post-COVID world could look like too. So from a care delivery perspective, in my mind, the face-to-face consult has always been, and I think it's even more so now, the highest premium service that you can have. The question is, what are the other modes and mediums by which you can consult and get healthcare advice? One is self-care. How do you do self-care? Is it through speaking to friends and family, speaking to peers, being online if you're digitally native, e-consultations, email consultations, telephone options, or video options? Most of these services have existed, but none of them have necessarily become mainstream. In the NHS in the UK, telephone consultations have been around for 10 years. I can do a 5-minute consult on the telephone, which would be a 10-minute consult face-to-face, and I can get most of my information. 80% of most diagnoses are done on the history. I need 20% to do my examination and maybe some investigations. And GPs don't learn the telephone consult in medical school. You refine it through 6 years of hospital rotation, followed by intense vocational training in your general practice time. And now you're saying, let's now make it video. The video consult is very, very different to the telephone consult. The governance around it needs to be quite robust to make sure that both the physician feels safe and the patient feels safe as well. So with Babylon, I admire what they've done with clinical governance, which is both, as I understand it, the video consult is recorded for life so that it's a testimony of truth, both from the patient perspective and from the doctor perspective. Currently, when I write the notes, I write the notes. Whatever the patient says is hearsay. So actually, does video allow you to have a better version of the truth should anything go awry and should there be any negative practice? But what does that do, to your point, around the transforming the practice of how you learn medicine and then how you teach medicine and how you then practice it? Because medicine is both an art and a science. Technology is absolutely the enabler, akin to some of the comments that's coming in the Q&A, but you still have to hold somebody's hand. You still have to take them through a pathway. And maybe the needs for somebody in their early 30s, 40s, who either have a single disease or have no disease diagnosed today, are very different to an elderly patient with complex comorbidities. And does technology allow us to triage and manage different patient cohorts with different needs in different ways to allow us to make the best use of technology where possible and the face-to-face consult when it's absolutely needed?
Thank you so much, Junaid. Shwen, I want to shift over to you, and actually I apologize. I'm going to ask you 2 questions and see what you can make of it. One, you have a very unique background. I mean, you've studied sciences, and you have this sort of digital expertise that you really were a pioneer in that. And I'm just wondering, when we take a look at the skill sets that will be needed going forward and the skill sets that you look for in hiring people and businesses, what exactly do you think is going to be necessary going forward from your perspective? That's question number 1. When you wrap that up, I have question number 2 for you.
Sure. I think, it really depends on the type of role that you're looking for, but certainly it has to be, in this day and age, someone that truly understands how to leverage a platform or a digital solution in a way that integrates with business and not necessarily just somebody. So the challenge I've always said is, having someone that grew up in a career that focused on digital and then shifted to innovation. I've had this really hard fight of pushing a rock uphill because, first of all, everybody thinks they know digital because everybody's on Facebook and Google and all that these days. And then the other part is everybody thinks innovation is as easy as just finding the next startup that's out there and working with them. But I think the core essence of it is understanding enough to actually to identify what the problems are that you want to solve inside and finding out how a digital solution or a platform or the right solution doesn't have to be digital. Digital just happens to be an enabler now. But if it's digital, how that actually integrates with the rest of your business. And that kind of person needs to really understand both the business side of things, the digital platform, and how the two can come together. So it's not just about knowing one or the other, but how things fit together and how they actually serve to solve problems and not just create a new platform to drive people to.
Yeah, so that leads into my second question, actually. You anticipated it, which is, there's a concept called the digital factory. I don't know if you've heard of it or not, but it's where the digital team and the business unit are actually almost warehoused together because the business unit understands the business. the science, the products, the economics, and the digital team understands the connectivity and the use of information. Do you think that because we tend to look at digital often separate from the business of health, that in health has made it particularly arduous for us to advance, to use information so that we can actually improve care and save lives? And Jane, I'm going to ask you your perspective on what Shwen says right now, so get ready, please.
Yeah, absolutely, Gil. I think for one thing, just having heard the conversation that happened earlier where we're talking about digital transformation, I think we have to start moving away from that. We have to start thinking of it as a business transformation that is empowered traditionally by science and to an extent data, but now that data is becoming very different type of data, different set of data that you're collecting digitally, and then empowered by digital as well as a modality. And so I think if we start always calling it digital transformation, we're always going to run in parallel with what the business strategy is. Whereas if we call it business transformation, which is empowered by science, data, and digital, then we're bringing the two together and figuring out how those actually have to work together. And so I think that's an important thing that we need to think about. I mean, for years, we've been talking about when is digital marketing just going to be called marketing, right? And things like that. Like, so it has to be part of the same thing. We just have to accept that this is how we do business these days because the modality of digital actually drives a lot more engagement, and this is how people use things nowadays. So we have to adapt to it. And so it's not a separate path. It's an integrated singular piece.
By the way, Jane, pivoting off of that, I mean, whole concept of Neo.Life, which is sort of integrating, in a way, integrating the mind. I mean, could you react to what Shwen just said?
People talk about science advancing one funeral at a time. And I can tell, Shwen as a digital innovator must have some arrows in his back to have reached that very wise conclusion that it's not about digital, it's about solutions, be they digital or other. And I think the mindset transformation is what we're really grappling with. This is healthcare is an extraordinarily regulated process, and the digital world is extremely unregulated, and it's very it's rapid transformation. The idea that a healthcare practice would reach out to a startup is terrifying to me, which is why having companies like Microsoft or Amazon or Walmart moving in this space is so interesting to me, because I think the innovation is going to be coming from some really unexpected directions. And so what we need to do is basically transform the education and training of our healthcare providers. And as Shwen was saying, we need to, of course, be professional and provide service to the patients and be accountable and so forth. But there's also this dynamic between, population and public health issues, the need to just be engaged in the design and continuous improvement of the healthcare systems. We have to learn how to incorporate data and technology, not because this is the latest cool thing, but because it's going to improve patient care and research. And then, the final and clearly most important piece in my mind is how to use our practices to basically eliminate inequities and discriminations.
Yeah, I want to flip over to Uri and then Amir on this way of thought, because Uri, you were not a startup. You had a established business based on a digital platform. COVID-19 sort of thrust you into the headlines. You really created a new population health infrastructure for a nation that went global very quickly. And I'm just curious from the sense of what was it, to Jane and Shwen's point, what was it, the practical application of the innovation, or people just grappling and saying, we don't have anything that works for us to understand how do we engage people, patients are people at the end of the day. So you had to create a system that created some, if I understand correctly, some equality between the health system and the people it seeks to serve. What was the tipping point, even beyond COVID-19 being involved? What was the mindset or cultural shift that went on in your conversations to sort of get uptake?
First, I would like to comment on the previous this discussion. I think from a digital transformation perspective, we are not even started to hit the ground, and there is so much that we can still do in healthcare in terms of digital. Take, for example, the virtual visits, the telemedicine, that basically replaced an existing process with a digital process. But what about all the new frontiers that digital will open up for us? All the quantify self that I can now do. Take a look at what Fitbit did with the COVID and their devices, and Apple Watch did with Stanford and the cardio. This is going to be a whole new shift in paradigm on how we consume, study, and how we consume care and how we study care in the future. So I think that's going to be a major revolution, and we are just in the beginning of the of the process. And I'm sorry, can you repeat the question? I just
yeah, I was just asking you. Yeah, I was just wondering, because Jane and Shwen really talked about how this had to really. We're not talking about digital, really. We're talking about systems or business transformation. And you had, Datos-Health, or Datos, it was when I first met you, was a very established enterprise. Now it was looking at, correct me if I'm wrong, you were actually initially looking at elements of health, but retail as well. And then you remember that, right? The pre-COVID-19 days, you were looking at retail platforms. And then all of a sudden, you popped into this global stature overnight, because you saw the person with a health concern as, to Jane's point, a customer. They weren't just patients, they were people with health urgencies and needs, needing to reach someone to express a concern about COVID or the need for testing and so forth, and actually do everything from the confines of their home. So aside from COVID-19, what was the mindset pivot point from the system that you saw? Because obviously that's what we have to retain.
So I think that there is a shift in the mindset of the entire industry of how we consume digital in healthcare in these days and in the future. And for me, as you mentioned, I have a retail background. And basically, Datos and a lot of the concept of what I bring to the healthcare market, I don't have any healthcare, by the way, background. So I bring from the retail experience that I have. We basically took a retail marketing automation concept, and the idea is to treat patient in the same manner that we are looking at digital marketing automation, and basically to wrap them around all this data and to really understand their behavior and their profiles. Now, what is interesting, at least in my mind, the way that we look at the industry, is patient is only one side of the equation. And it's always very popular to talk about patient engagement, but when you try to implement remote care, and I'm trying to create a hybrid mode where clinicians do sometimes remote and sometimes physical encounters, their engagement is not less important than the patient. And when me as a patient, when I'm getting, will get or gets a text message or a message from my clinicians, the same one that I met in the hospital a few days ago, I'm going to be 100% engaged. But to enable that, I need to look also at the clinician as a consumer, and I need to take care of their experience of the solution and to solve them the exact problem at the exact time with the exact context of data. And this is really difficult.
That's really understand. Yeah, it's a different twist. I'm gonna, since you mentioned that, I'm gonna go to the two physicians on our panel today, Dr. Kalali and Dr. Bajwa. And Amir, one of the things that you've been a champion of, certainly through the communities you create, the CNS Summit, is this concept of collaboration. And And Uri's talking about a whole different mindset right now. He's talking about, in a way, it's building on what Jane and Shwen just said. He's talking about each segment of the health ecosystem as a customer, as a consumer or a customer of each other, which is a very different perspective because we're sometimes appealing to a segment without looking at the other segments. He's saying, hey, all of them have to be seen as customers. In the retail world, that's what I would do. So Amir, I mean, you've been a champion about this as a physician building community. Can you reflect a little bit about what Uri is saying and offer your own perspective? And Junaid, I'd be curious your perspective as well.
I think connecting that to what I was saying previously, whether things help, whether it's clinicians or patients, like Uri said, when it comes to business leaders, they think about multiple other factors, right? Not just that. To us, it should be obvious if something that really helps patients and helps clinicians or should be a good thing, why don't we just do it, right? And the answer is kind of those business cultures that really are very used to their business models and happy to do that. So collaboration is now a very overused word. The truth is that in terms of private companies, there's not a great history of people collaborating when there should be, even if it's in the patient's interest. So that's what we have to drive for, is how do we persuade people it's in their business interest to be collaborating and becoming more efficient. So that's I just don't think that we're there yet. I think we need to fight for that. I don't think it's as simple as COVID's happened, everyone's suddenly enlightened and they're going to do the right thing, right? So I think that's the case. The case is how do we advocate for those changes?
I'm thinking, Amir, and I wonder if you could just comment on it. Yesterday when we were talking about the panel, you said something that I thought was so insightful that it should be shared with our audience today, with our attendees. You sort of referred to the fact, and I've heard John Nosta say this before as well, that culture or behavior trumps systems and innovation. And I'm going to ask you to put back on your cap as a psychiatrist for a moment and ask, when people's lives are on the line, why is it that we're so averse to making radical change in our system? And certainly retail companies will make radical change to serve their customers. Why are we so slow to make change?
Well, behavioral change is extremely difficult, especially at scale. And COVID has shown us that we've all had to have behavioral change. And what has it done? Everyone's feeling uncomfortable, right? No one's enjoyed 2020. So it's the same thing. If you have C-suites by people who are older, who are not necessarily tech savvy, who are used to, making money the way they've always done. Nobody wants to change if they don't have to and if they're doing well financially, right? It's just not within human nature to do that. I think the upside of COVID has been really to have shown to people the things that they really resisted, not for good reasons and not because the technology wasn't there. So it's not a question of using new technology, it's just leveraging what we already frankly have had for a while. The real barrier is that kind of business resistance to this. Basically, we have the antibodies within large enterprises that get into action as soon as they see an antigen, right? Which might be innovation.
Yeah. Junaid, could you comment on that? I mean, you're sitting in this small company right now called Microsoft, and Microsoft is known as an edgy, somewhat disruptive company, and not referring to Microsoft at all, but you've been at big companies as a change agent, as a champion for disruption. I mean, what's your perspective about looking at the system itself as the customer of the system?
So great questions as always, Gil. So two thoughts. One is, I think this framework on what is important to healthcare professionals, what is important to patients. I'm reminded of Don Berwick's Institute for Health Improvement, and where they used to talk about a triple aim, I think that's now been evolved into a quadruple aim. The quadruple aim being anybody who's interested in healthcare should try and do four things at the same time. One is improve the experience of care to the patients and public they serve. Two, improve the experience of care to that individual or that team that is delivering that care service. Three, reduce the per capita cost of healthcare spend. And four, ultimately improve outcomes. That's really hard. In some of the big organizations that I've worked for, it's very difficult for them to think about all four at the same time. But the real responsibility in healthcare is to do all four at the same time. That's the responsibility that I try to take on in whatever hat I have. And if you want to do impact at scale, I think you have to have all four of those things in mind. If you overcompensate on any one of those, you're doing a disservice, and whatever you do won't be sustainable. It might hit your margins for the short run, but you're not going to think about the long run benefits. And ultimately, I believe you have to do all four at the same time.
Please continue. No, I'm sorry.
I think change is really hard, right? So speaking from the inside, organizations, to Amir's point, are not necessarily up to do disruption. They're designed to maintain the status quo. Once they get to a certain point, they no longer feel the need to massively innovate across the entire enterprise. They hit a point of plateau, and without realizing it, they've made so many bureaucratic decisions and invented so many new policies, which are all designed to maintain the status quo versus change it. So Shwen's point around business transformation is absolutely right. And the same methodologies that we use in discovery science and in development, building hypotheses, validating it, learning from these, can you extend that across the entire value chain of pharma? And I think that's really, really hard. So trying to get one project done in a previous role, I had to navigate 17 different parts of the organization to do the right thing that was already part of the strategy. But who was going to take the time to roll up their sleeves and navigate those 17 different things? The thing that trumped it for me was the mission statement of the company was around the patients and public that we served. If I didn't do it, nobody else would. And that's what drives me. And if I think about Microsoft's job is to empower everybody on the planet to do more with technology. So the nice thing is that it's not about cannibalistic behavior, nor is it around creating bespoke solutions that only they can benefit from. It's really about benefiting society, benefiting people, and allowing others, be that Datos is a partner of Microsoft. What can Datos do more of if Microsoft were to build more things on the cloud? And what does the cloud need to be able to do in healthcare, which is different to what it needs to do in finance? So for me, it's fascinating to see how the technology world is adapting at pace and trying to think about what its responsibility is with COVID. So the amount of Teams adoption I have seen in the last 6 months is extraordinary. What I've seen with the chatbot and what that's doing for rural markets, impoverished markets, as well as developed markets, amazing. The amount of work that's happening around democratizing access to research and data using neuro-linguistic programming to ensure that whatever's in the Chinese script is also transferable to the English script and vice versa, so that scientists have access to the best moment-in-time information for the purposes of vaccines or treatment. Extraordinary. We live in a world where this information exists today. How do we make that information meaningful so that the people who are at the front line of creating treatments or vaccines for our future in this wartime effort can do that? Is completely powered by technology, ultimately delivering that quadruple aim of healthcare.
Thank you so much. Now, I just want to turn the conversation over to something that always pops up, and we've talked about together in the past. And I want to start off with this question of privacy. And I'm just curious, because we have a global panel here and we have a global audience. Is our perspective around privacy, is it regional? Is it national? Is it by urgency? In other words, will people shrug off privacy for a COVID-19 vaccine? How about a better treatment for cancer, or access to cancer, or to get in a clinical trial? So I just want to do a bit of a quick round robin with everybody on this, because I'd be curious to get your perspectives around, in our space, because of HIPAA control, certainly in the United States and other nations, something similar. Is privacy an obstacle or not to digital transformation or business, as Shwen mentioned, business transformation in the health sector? Is privacy a blockade, or is it really just something we've just got to address? Let me start with Shwen first, because he's been championing this, and Jane, and then I want to jump over to you. But Shwen, what do you think about privacy? I know it's on everybody's mind. Could you start us off?
Yeah, it's a great question, and I think we live in an age now where privacy isn't just about healthcare data; it's about any data that we have, whether we're using the internet for any number of things, our mobile phones or anything. And certainly, you can see with the big tech players, they're already being challenged by what they're doing to preserve privacy and how they're actually looking at it and what they're doing without data. But when it comes to healthcare, I think people have a slightly different lens. I mean, they'll trust Google or Facebook and so on with their daily social data. But for healthcare, they're holding it to a different standard, and rightly so, because it's very personal data that we're talking about. I think in terms of obstacle or not, I think it's not an obstacle as much as finding the balance between how we can leverage data in a responsible way to really empower and bring better outcomes for patients at the end of the day, versus, all the legal and regulatory blocks along the way or checks along the way that need to happen in order to ensure that we're maintaining a standard for how we handle that data. So I think it's more about finding that balance rather than really saying that it's an obstacle.
Thank you. And Jen, I've got to add to the question to what Shwen just said. Is it that we don't understand the value of sharing data in health? Is there something that as a sector we're not expressing? Because to Shwen's point, I mean, we'll trust PayPal with our credit card information, but we won't trust a drug innovator in a category that could actually improve our lives with our health records. I mean, Jane, what's your perspective on that as someone who's really looking at the mindset of people?
So one of the founders of the Electronic Frontier Foundation, John Gilmore, used to say that censorship is like a malfunction and information routes around it. And so I'm thinking about privacy as sort of like the censorship of the neobiological transformation, because wherever there are blockades, there will be other people trying very hard to get access to that data and to provide proof that there is benefit to that, as well as sufficient protection in place to prevent to allow the innovation to proceed. And I'm constantly struck by the willingness of people battling disease to share their information. There is just a tremendous desire to help researchers and medical personnel understand a problem. So the question is not, is the consumer willing to give up the information? The question is really, how quickly can we keep up with the potential hacker that's going to hack through your system and get that data and use it in a spurious way? Or, frankly, the insurance company who will, or your employer, who could potentially use that information to manipulate your behaviors in some way. So that's where I think the tension lies. As Shwen said, I agree with everything Shwen says. Well, all of you, by the way.
And we agree with what you say, so we're all hug.
Well, that's why I really wanted to get in it with Amir, because I thought that would be much more fun. But anyway, we're having it in a private
peaceful
chat.
guy. I peaceful panels.
But it is, it's a slider. There's just a number of different ways where we have to navigate the balance. And, where the HIPAA rules are in place, it cannot be, it's a short-term problem. It's a thorny and messy one, and it exacerbates the complications.
So Uri lives this problem because one of the features, absolutely, because one of the features of Datos is a GPS system. And so he has to deal with the fact that with people with an illness or a contagious illness are being could be tracked. I mean, Uri, what's your perspective on this? You're kind of in the hot seat here.
First, I think you talked about privacy. We also talked a little bit about security. It is important to distinguish between the two. And when we, in my personal opinion, and the way that we develop our platform, privacy is not a question, it's a must. It's not something that we can, and everybody was telling me that it's very hard to do innovation when you have to comply with privacy rules. That's BS in my mind. I'm sorry for the language, but privacy is a must, and we need to maintain it at any given point of time. What I think people sometimes are missing in that sense is how we deliver privacy in the right user experience to the patients and to the clinicians. By the way, I'm looking at them at the same. And user experience here is the key, and to allow them to understand how we're going to use the data, who is going to look at the data, what are the means that they can control the data. And you mentioned, for example, the GPS, and in some of the occasions during the COVID, several counties in the US used our platform to monitor positive COVID-19 patients, it was easier for them to turn on the GPS tracking. And instead of going around the houses to make sure that people actually comply with the quarantines, they actually looked at our platform. but we had it mandatory that it will be opt-in by the patient. So the GPS tracking had to be opt-in by the patient, and it always, from a user experience perspective, you always had like a red flag that the GPS tracking is now on, and you will know about it. You will be aware about it. And there is a whole different way of both user experience, but also from the system perspective. When I'm uploading a blood pressure reading from a blood pressure device, there is a different, me as a patient, I'm expecting different privacy standards because I'm doing that actively to my provider. Versus if my GPS tracking is passively behind the scene on my phone, this is a different user experience that I need to manage and to think about.
Yeah, you're having to navigate both. To Jane's point, you're having to think through both. You know, Amir, you've been looking at these issues. I had the privilege of meeting folks from My31 and talking about privacy for some time. I know this is something that's sort of high on your radar screen. Any words of counsel for our listeners?
So what I would say is, first of all, it's a false dichotomy to say it's privacy, and this is going to Uri's point, that privacy is somehow a block to research. That's just not true. You can absolutely have privacy and enable clinical research. So that's the first. The second thing to say is we assume that just because it's a bit like arguments on Twitter where people assume everyone's kind of as geeky as they are. Most consumers do not understand how much their privacy is being, at least as we speak, violated on a hourly basis by many, many players, right? So our privacy is suddenly in jeopardy in the US more than anywhere, quite frankly. So that's one. The second thing is, large tech companies are obviously all coming into the space. Now, I will tell you that people should have a very different view about Apple having being involved in their healthcare versus Facebook. Facebook's actual business model is on violating your privacy. That is their business model. Okay? That is not Apple's business model. Amazon's different. Microsoft's different. So I think there's some nuance to when you ask, well, should people trust healthcare with their data? Actually, it's really being enabled by large tech companies. And the question is, what's the track record of those tech companies? And what's the legislation going to be in the US versus EU and other places that have much more robust legislation?
That's great. I mean, Junaid, I want to switch for a second as we begin to wind down and ask you sort of a very critical question. We've been really talking about the developed world. And I know something that's on all of our minds right now, particularly as we're dealing with a pandemic, that can only be overcome when the globe actually has a response. I want to ask you specifically, how will innovation of the nature we're talking about press forward, maybe be tested in the developed world, but be of help in the developing world, in Africa and certain areas in South America and Asia? How will we marshal all of these ideas and bring healthcare to people who sometimes need it the most?
So that sounds like a thesis and a PhD exam.
Only you could do that in a few moments. I know that.
So I don't think there's a magic bullet or an answer to it, but there's incredible innovation that is at grassroots in every developed country that I've had the pleasure of connecting to. And the question perhaps is, how do you just connect the people who are articulating the right problems to people who want to be inherent problem solvers to do that? And the nice thing that allows us to do that through technology today is that much of this is without boundary. Currently, we're having conversations across Israel, East Coast, West Coast US, the UK, and we're all having a conversation together. Will that change in a post-5G world? Will that change with various government legislations and other impetus and drive for healthcare? So, Jill, you and I met the founder of Babylon, who was doing tremendous work in the UK, but through a partnership with the Gates Foundation was able to then think about how they could deliver primary care services in Rwanda through both a public and private sector partnership, but then really thinking about affordable and accessible healthcare to 2 million people in Rwanda to then say what is their health need and how can technology developed in developed worlds then be delivered on the ground in areas such as Rwanda or indeed India or indeed Southeast Asia. I think we've also seen incredible innovation coming out as a part of a COVID response. So I was part of a mentorship scheme for a group coming out of Southeast Asia, but a huge innovation happening around when we don't have access to ventilators. What do you do for that part of the world? You need to do frugal innovation in a way that we would never even imagine, be either in the UK or in the US. At the same time, what can developed world nations learn from developing world nations? And there is tremendous skill sets, talent, and knowledge bases around how they look at disease and how they manage disease that can teach a thing or two to the West as well. So I'd say the COVID response, in my mind, as an example, there's been some countries that have done an amazing job, and others, we won't go into a political match on this one, haven't done as good a job as they should have done. But you take countries like Vietnam, you take countries like Iceland or smaller countries in the Nordics or indeed New Zealand, what a tremendous thing that they have done. But they implemented incredible policy fast, had a huge emphasis on population health and thinking about what they could do for that population with the technology at their disposal and the healthcare system at their disposal to make a difference. So hopefully I'm sensing a much more global emphasis on healthcare. I hope we listen more to organizations like the World Health Organization and think about how we power those organizations to do more to help us, not just through this pandemic, but future pandemics too, and use data to drive the right insights, to make the right decisions, and try and think about healthcare without boundaries in the future.
That's fantastic. Junaid, I knew that you would sum up the whole aspect of developing world in a nutshell, in a thesis in 3 minutes. Fantastic. We're wrapping up now. I want to ask each of you just a sentence or so. If you were to say post-COVID-19, what is the sort of the transformational change or the business transformational change that digital will affect in the health space? Can you say something in a sentence? Junaid, let's start with you.
So I think a lot of people have been speaking historically around the affordability and the accessibility of healthcare. What I would love to see is also equity in healthcare. I think at this time, just in this sentence, not only have we had to deal with COVID-19, but we've had massive social inequalities which have come to the fore. So could we, as a industry, really think about equity in healthcare in addition to affordability and access?
Excellent. Amir, what do you think? Your thought about the future?
As always, Junaid really sums up, what we all want and feel and wish for really so eloquently and beautifully. I would say beyond what Junaid said, which I think is critically important, is really thinking about how we can take this as an opportunity to really rethink what we do. It's very rare for us to have such a disruptive force come and whack everyone in the head. So if we can't change now, when can we change? So for me, this is just an opportunity to really use this time to really be thoughtful about how can we really, in a dramatic way, rethink what we do, which includes the points Junaid's making.
Incredible. Jane, what are your thoughts here?
Okay. Of course, that's what I was going to say too. I was going to say Junaid's.
Great minds think alike.
Yes. Well, I mean, I think it really speaks to what our priorities are, as humans and as people. I'm not an innovator in healthcare space. You guys are. But I would just say that I think we know that this is not our last pandemic, and we now know what a global impact it can have, and it adversely impacts people who are already being negatively impacted by our healthcare systems. So I think, what I'm excited about is people understanding that the world has changed forever as a result of this. The 1980 flu had a lot of persistent impacts, but the 2020 epidemic, I think, will really make the case for every aspect of every healthcare system around the world to look for opportunities to think not just about individual healthcare, but about public health, and try and balance those priorities with our privacy concerns in the way.
Thank you so much, Jane. Shwen, what's your sort of like takeaway thoughts?
Sure, of course, like everybody else, equity and access were top of mind in terms of where this would go. But I think, in addition to that, I think it's the importance of the role of data and what you can do if you could harness that data, and also the role of individuals as citizens, as patients on contributing to that kind of data that could be used for the good of the world. And then the other thing that I hope will come out of this is something that Junaid actually touched on, which is we often think that all good things come from big companies and trickle down to smaller companies or countries for that matter. But what can we learn from smaller places that are more agile, that are more nimble, that are doing things in a more flexible way that bigger countries and bigger companies can learn from and adjust in a similar way? Because I think that those are lessons that can certainly be helpful to all of us.
That's fantastic. Uri, why don't you have the final word here? I went in alphabetical order, by the way.
So it's going to be very difficult. It's going to be very difficult for me to say something smart after all these comments here. But I will try to take it from a different. First, I totally agree with everything that was said here, and I will try to take it from a different angle. I think that the pandemic actually proved that we can be agile in healthcare, and my hope is that we will sustain and keep that agility also in the future, and not go back to where we were before. From the private sector, we proved that we can do the digital transformation and we can help the healthcare industry. I think now it's on the public sectors and the governments to prove that we can support in the agility manner our digital transformation. And I hope that the two will coexist in the future. That's the backbone of innovation and to have a better healthcare system in the future.
That's fantastic. First of all, I want to thank our 5 panelists for your insights, your time, your sharing. This is, as Junaid said, I think that we got a doctoral thesis of information today. I thank all of you very much. Obviously, I encourage people to follow our colleagues on Twitter, on LinkedIn, go to their websites. You'll find the Neo.Life book on the Neo.Life website, all of that. I want to thank our sponsors, particularly. I want to thank the Gallion Foundation and its Secretary General Bruno Cohen for putting this together. I want to thank Levi Shapiro of mHealth Israel, a major force in a market of great innovation. I want to thank Business France for stepping forward and making sure that French innovation would be front and center, and my colleagues, of course, at Fin Partners for supporting this effort. Now I want to turn this over to our chair of our program, Professor Eugene Kandel, to provide some closing comments.
Thank you, Gil. My head almost exploded from all this.
I hope in a good way, Eugene.
But well, I don't know how the head can explode in a good way, but hopefully I still can hold some of them. So I'm going to try to summarize 5 points. The first point is digital health was hard before, it will be hard in the future, but hopefully easier because post-corona, Corona served as a trigger. Crises tend to do that, and this one changed everything and allowed us an opportunity to rethink what we do and make paradigmatic changes. The second point is, will it stick or not? On the one hand, we basically have no choice because there will be much less supply and more demand, and we don't really financially have the ability to grow linearly. Telemedicine may be an obsolete term because it's still linear. It may be a completely digitization, may be a completely different concept because it may focus on prevention, on compliance, on various things like that, much less on treatment that is in some cases harder to replace. It is very much became more, can we afford not to do this rather than what we had before? Why should we bother to be among the first to adopt it? On the other hand, while COVID accelerated some technologies, it delayed a lot of areas as well, medical devices and others, because of slow clinical trials. As many of you said, psychology and social norms are sticky. On the other hand, we did see them change quite quickly in the last decade. So maybe there's some, smartphone is an example, maybe there's some hope. Another blocker is a fragmented universe, much of it due to regulation, which may stifle innovation by small companies unless we prepare sandboxes and can help them engage. Large companies don't tend to innovate, but from our experience at Startup Nation Central, we see a lot of them, hundreds of them coming only to us, but they all obviously go to many other places in search of open innovation. So that's a good sign. Overall, within the panel, I detected a somewhat stronger sentiment that healthcare will definitely not stay the same. The access, the efficiency, the ability to grow non-linearly, equity will prevail. Having said that, we all agree that supporting business models will be crucial to solve the problems rather than just technology on itself. Side point that developed and developing world will have maybe different pace of adopting this, because in the developing world, the status quo is much less appealing and much less entrenched. Rwanda is a great example. We've been working with this country to try innovation. And there are other examples. India is doing some interesting things. The third point is, what's the role of pharma? Pharma is an interesting place for innovation because basically it can use digital technology in all stages, from molecule discovery with AI in clinical studies using various EMR sources, Industry 4.0 in production for flexibility and resilience, AI in compliance and remote monitoring. All that is part of the process. So far, we don't see that as one process, but I think it's getting there. The fourth point is that to make innovative digital transformation, it has to be across the board. Digital capabilities based on big data must become the basic tools, just as medical tools and business functions, etc. Failure to combine them is very problematic. Epidemiology is a good example. The way we deal with corona is not that different from the way our ancestors dealt with 1918 Spanish influenza 100 years ago. And yet, in these 100 years, a completely different set of tools and huge amount of data became available, but our strategy didn't incorporate them. So we have to really change that. So business strategy has to be built on three parts. It has to be built on healthcare goals and tools, on data tools, as well as on business and processes tools. For that, you need to train healthcare providers, administrators, and executives to combine all these three sets of tools, and I don't envy them because that's much more complex than what we had to learn. And the last one is there are 4 goals that you need to accomplish at the same time, and all this requires a lot of data sharing, combining, because you can't accomplish them separately. So that brings us to privacy. To what extent is geographically determined, and what do we mean by it? Is it lack of sharing or security of shared data? Can the regulatory environment in a country around this question become a competitive edge or a blocker? Israel started EMR collection for about 7 million people over 20 years ago. So we have a long longitudinal data, and yet it took us many, many years to start using that data in research and business models. So we've lost a lot of edge that we had maybe 8-10 years ago. Estonia shows how it's possible to live in society with a lot of data sharing. So the question is whether we're going to opting in versus opting out, and whether the new social norm will be established around privacy. So that's basically the 5 points that I got out of it.
Thank you, Professor Kandel. Thank you for that amazing summary of an amazing conversation. Again, I want to thank you for your role as kicking us off and summarizing the conversation. I want to thank our sponsors, the Gallion Foundation, Business France, mHealth Israel, and Fin Partners. And of course, I want to thank our wonderful panelists, Dr. Kalali, Dr. Bajwa, Jane Metcalfe, Shwen, Gwee, and of course, Uri Bettesh for joining us today and preparing for this. You've added so much insight. We thank you. Again, for more information, go to Neo.Life.com, go to CNS Summit, go to the different organizations' websites, their LinkedIn profiles to learn more. Stay in touch with everybody, and let's continue to improve human health together. Thank you all. Good day.
Thank you.
Thanks, Gail.